JJ Staiano, consultant plastic surgeon to the stars. So if you've got any cues, then please put them down in black and white and get in the queue, because there's quite a few cues queued up here. Okay, so count yourself lucky if you get your cue aid, but I'll be honest with you, you have got a very high chance of getting an aid, because that's how I roll. I just answer the cues. So I'm going to start off because I've got some already, thank the Lord, because otherwise I might be waiting here all night. So yeah, the first one that I've already got goes something like this: does it hurt to have a mole removed? The thing that hurts is the local anaesthetic. So the local anaesthetic does sting. So I think it's not completely nothing, but I would say it's probably not as bad as you think it is, and it's all, you might say that's easy for me to say, which indeed it is, but I think just from how patients often are, they often are quite worried and quite anxious, and like afterwards, usually it's kind of not as bad as they thought it was, especially something like a mole, which is by definition superficial. It's kind of on the skin. You're not going to have to go down delving deep for it. So a mole is usually pretty okay, but it does sting. There's no question. The local stings a little bit, but that's literally for seconds, and then once the local's in, you'll be away. A bit like going to the dentist. I mean, maybe even better than going to the dentist, I would say, depending on where the mole is, I suppose. But places like the nose, it's a bit uncomfortable when the skin's really tight. Palm of the hand, sole of the feet, stuff like that. But yeah, stings a little bit, but hopefully not too bad. Is the answer that I'm going to give to that question. So the next question that I've got says, how long before I can get back to my normal routine after having a lesion removed? Well, I guess it depends on what your normal routine is. If your normal routine is like sitting down and not doing too much, straight away, pretty instant, basically. But if your normal routine is getting in a boxing ring, then 6 weeks. So yeah, I mean, the you can get back to your normal routine relatively quickly from a sort of physical medical point of view. So you could go back to work that afternoon if you wanted. I mean, most people do kind of take the day off, but if you're self-employed, or you can get back into doing things straight away. The only thing you've got to do is try and take things easy. So obviously, if you're active, if you're doing strenuous stuff, then you've got to take it easy for a few weeks. So if you're just doing sedentary work or sedentary life, then you're straight into it, driving straight into it. They do say on the local anaesthetic you're not supposed to drive for 24 hours, I think it is. But a lot of people do drive, to be honest with you. It's like when you go to the dentist, you don't not drive to the dentist, do you? Maybe you do. Well, if you do, then don't drive. But if you but yeah, so you're pretty much straight into things. But if you're doing lifting, bending, stooping, doing weights, stuff like that, a few weeks, a month. I mean, it depends on how big the mole is, how tight it was, what area it was on. So obviously, if it's on your arm and you're doing that, then you probably want to take it easy. But the wound will be healed in a week. So yeah, pretty much straight away. But if you're doing strenuous activities, maybe a week, maybe 2 weeks, just to let the wound heal. And we can guide you on that, because we'll see you at a week anyway, whether that be in the dressing clinic to remove the stitches, or just like virtually giving you a call after a week to see how you're getting on. Because everyone's different. Some people take a little bit longer to heal, so you might be a bit more taking it easy if you're one of those people. And some people heal really quickly, so you might be getting into things a bit more quickly. So yeah, case by case basis, I would say, is the answer to that. Jackie, nice to see you. Jackie, if you've not found something better to do on a Tuesday night, come on, have a word with yourself. Right, you must have heard all of these, Jackie. Have you heard this one? Will I have a scar after having a mole remove, especially if it's on my face or somewhere visible? Yes, is the answer to that one. I don't know if you've heard that one before, Jackie. I don't know if I've had that one before. But yeah, I mean, you will. to a greater or lesser degree. So there will be some kind of visible scarring, but we try and minimize the scarring, and we do the least traumatic thing that we can do in order to remove the mole. So if it's, for instance, skin-colored fleshy mole, you might have a sort of raised, you might have a shave excision, which gives less volume of scarring, as opposed to a formal excision, which you cut out sort of brown, pigmented, flat mole. You'd have to cut that out. So whatever you do, you need to remove that piece of tissue, which will heal and which will leave a mark. Often the mark fades so well that people think that they haven't got a scar. So it's not uncommon for people to say, oh, I had my mole removed and I haven't left a scar, because it's not visible. I mean, I suppose that's fair enough, is it? If a scar's not visible, is it a scar? Just thought of that just now. I mean, we're getting into philosophy here. Is something that's not visible still a thing? Wow. So maybe you can say it doesn't leave a scar if it's not visible. Crikey. Oof. Wow, that's deep. So, well, yeah. Well, in that case, sometimes it doesn't leave a scar. I'll go out there and say that. I normally say it always leaves a scar, but often you can't see the scar. So therefore, by the earlier definition, there is no scar. So, wow. And the good news is, if it's on your face, which is obviously a lot more of a concern if you're having a mole removed from your face, that scar's a lot better than the body. So on the body, it's much less common to have these invisible scars. On the body, you would often be able to see a mark where it was. On the face, it's relatively common for it to fade so well that you can't see it. Not everybody, and you have to be prepared to be able to see it. But it is the case that often you can't see where it was. So therefore, I guess you could say it hasn't left a scar. Wow, I'll have to ponder on that. I'll have to sit in a quiet room to think about whether that is actually a scar if you can't see it. But maybe that's for the philosophical Q&A, which follows on from the medical one. So we'll be doing that at 7:45. Okay, so sticking with the medical one, leave the scars. And you've said, especially if it's on your face or somewhere visible, it'll leave a better scar. So that's the good news. But still, you have to weigh up the scar with the mole. So, if you're not sure, then keep the mole. But if you want the mole removed, you'll have to have a scar of some description. Although, as discussed earlier, maybe I shouldn't. I usually say that to patients. You have to have a scar of some description. But if you can't see, anyway, yeah. Okay, I think we've come to the limits of what we can do in the philosophical side of things with that one. So let's stick with medical. I hear you cry. So okay, I've got another medical one. I've seen videos of people popping cysts at home. Have you? There are videos of that stuff? Well, probably isn't there? Why is it risky to do it yourself instead of seeing a plastic surgeon? Right. Well, popping a cyst. I've not seen a video of anyone popping a cyst, but then I probably haven't lived, have I? I haven't cruised YouTube for long enough, or TikTok. But TikTok, there's videos of people popping cysts at home. I mean, when you have an infected cyst, the treatment is to drain it, which means getting the stuff out. So we will often kind of, I guess, pop it if it's infected to get the stuff out, to let the stuff out. So that's the treatment of an infected cyst, to let the evil humours out. If you are just kind of popping a cyst that's not infected, just a cyst as it is, might be a bit traumatic, might cause a bit of scarring. I think risky is pushing it a bit. I wouldn't say it's risky. I mean, I guess if you're doing stuff in a non-sterile environment, you can get infection and introduce infection, especially if you're squeezing very hard. So not particularly recommended. But the main thing about kind of popping a cyst is that whilst it might be satisfying, it will not get rid of the cyst, because the cyst will remain. So if you just get rid of the contents of the cyst by popping it, that's giving you a temporary temporary relief, so it will make out that the cyst might look like it's gone, but the cyst wall will still be there, so it will refill and it will recur. So it is not a definitive treatment. So I wouldn't say it's risky doing it at home. I would say it's kind of like not much point, unless, as I say, it's painful or infected and you might want to drain it and get the badness out. I guess there's a point there. But if you're trying to get rid of your cyst, popping it or stick a needle in it or stick a knife in it or anything like that will get rid of the contents but won't get rid of the cyst wall. The other thing is, if you have had a lot of trauma to it, so if you are popping it a lot or traumatizing it a lot, it does cause scar tissue in the area, which makes it more difficult to get that cyst wall out. If you want to get a cyst wall removed completely, you have to take all of the cyst wall out, and that's why you need to see the plastic surgeon. I know a good one, a great French one. It's got 2 thumbs. Yeah, moi. So your plastic surgeon is, obviously I'm biased, but surgeon, doctor, whatever, someone, medical type person, if you want to get your cyst removed definitively. I wouldn't mess about popping it at home and doing stuff at home. It's a fool's errand. Don't do it. Don't do it. It's not going to get you anywhere, and it might make it more difficult to remove when the time comes. How do I prevent new lipomas from forming? One of those questions where you kind of wish you Googled that. I wish I Googled that before I came on to see if Google says anything. But you know what? Maybe the person who's asked it has Googled it and realised that Google hasn't got an answer for that. I mean, I haven't got an answer for that. I don't know of a way to prevent new lipomas from forming. Some people, well, first of all, let's be positive. I think being positive is really important. And it's not uncommon for someone to have a single lipoma, just one lipoma. If you've had one lipoma, that doesn't necessarily mean that you're going to get others. So be positive and don't think you're going to get more lipomas. However, some people do get a lot of lipomas. And for those people who get a lot of lipomas, I don't know how you can stop them. I don't know if we know what causes them. And there's no treatment that I know of to kind of prevent them from coming. Unfortunately, sadly, I don't know of any. So it's just a question of sort of treating them as and when they come, which I know isn't helpful. It doesn't sound helpful, but I don't have no answers for that one, I'm afraid. Look at that. Stump the surgeon. Surgeons, well, not stumped. I don't think there is an answer. So, but still, well done for asking a question for which there's no answer that I know of. There might be an answer out there. If any of our viewers know of any ways to prevent new lipomas from forming, please step forward now. No. Okay, none of our viewers know of a way. So, I mean, that's quite a large. If none of our people said hello. Hey, all people are saying things on TikTok. So there are actually some viewers on TikTok. Look at that. That's real people. Yeah, presumably real people. User big long number. Is that a real person? User 404. Anyway, potentially real people actually on the Q&A here. So let's not get ahead of ourselves. So I can answer this one. Well, I feel like I got a line with the suntan marks or a hat, which looks quite ridiculous. That's what happens, people, when you see yourself on TV. Yeah, start noticing these little things. What's the difference between a cyst and a lipoma? So the first thing I would say is that if you've got a lump underneath your skin, it could be a cyst and it could be a lipoma, but I wouldn't worry too much really about it because it kind of doesn't matter from your point of view. They're both benign and they're nothing particularly to worry about, and they can both be removed. The job is not to decide whether it's a cyst or a lipoma, so I wouldn't get into it too much. And the treatment is kind of similar in terms of the fact that it's surgery, so you sort of cut it out. The difference from a medical point of view, if you're looking for someone who's got a lump underneath your skin and you're thinking, is it a cyst or is it a lipoma? A cyst is a skin lesion. So a cyst is attached to the skin. there's often, not always, but often a thing called a punctum, a little hole that that sort of the attachment to the skin where stuff can come out of, and it's kind of within the skin, so it moves with the skin. A lipoma is subcutaneous, so a lipoma is underneath the skin, so you should be able to move the skin over the top of a lipoma, whereas you can't with a cyst. A cyst is sort of part of the skin. Lipomas can occur any depth, so you can get lipomas deep. Cysts are always just right underneath the skin, but well, at least skin cysts are. You can get other types of cysts, but let's not complicate things. We're presuming you're asking about skin cysts here. So yeah, they're right underneath the skin. Lipomas can occur deep. Therefore, we will often ask for a scan with lipoma because sometimes they can be underneath the muscle and they can be quite deep. Now, when they are deep, they're less likely to be problematic. So if you can feel it, if it's a nuisance, especially if you can see it, it's unlikely to be too deep. The deeper ones you tend to not be able to see and feel, therefore they tend to be less of a problem. So you might be more inclined to leave it. So that's kind of works out quite well. But if you did want it removed, especially if it's large, we would often ask you for a scan just to see how deep it is, because they can be within the muscle, they can be deep to the muscle, which can make it a little bit more difficult to remove them if it's going to be done under local anaesthetic. When removing them, a lipoma's, I guess, a little bit easier to remove because it's a fatty lump, whereas a cyst, it has got like a wall to it, and you have to try and keep the wall intact. You try and keep all of that wall intact when you remove a cyst. So you have got to be a bit more careful when you're removing a cyst, because if you leave some of the wall behind, it can come back again. So you've got to be a little bit careful dissecting out that wall, and it is a little bit more easier when it's not been infected or meddled with. That's why it's good not to meddle with it. So talking earlier about meddling with cysts and popping them and things, you can't really pop a lipoma, so that's not really a thing. As I say, it's a fatty lump deep to the skin, but a cyst has communication with the skin, so you could pop it. The other thing is that cysts can get infected, they can get bigger, they can swell up, they can discharge, and you can get an abscess. So you can get problems with cysts, which you tend not to get with lipomas. You don't get infection or swelling up or these sorts of symptoms with lipomas. So that might give you an idea between whether it's a cyst or a lipoma. But as I say, if you've got a lump underneath your skin, I wouldn't lose too much sleep or try and research too much into it, whether it's a cyst or a lipoma, because if you want it removed, just get in touch and we'll have a look. And sometimes I'm not sure. Sometimes I'm not sure if it's a cyst or a lipoma, because it can be difficult to tell if the skin's moving over it or not. And you're not sure. It might be quite a superficial lipoma, which is right underneath the skin, and you think, but as I say, it's slightly academic, because when we cut it out, you can tell, but you cut them out kind of just the same. As I say, you need to be a bit more careful with the cyst than you would with the lipoma, but still, nevertheless, removing them is the treatment, and you try and remove the whole thing out. So you still have to make an decision about the size of the lesion, whether it is a cyst or a lipoma. So yeah. Right, before you inundate me with questions one at a time, please form an orderly queue. Does anyone have a question? Because I have, got about 30 seconds. Got the rest of my, oh God, what's happened? Oh, sorry, what happened there? Sorry, what happened there? Yeah, no, I've got the rest of my life, to be honest. Someone's got, Stina Kathura's just got the #1 gifter badge. So Stina, thank you. Hey, so that's kind. Hey, nice to see you there. A bit of interaction there on the TikTok, with my people. Yeah, thank you, people, for that. If there is no objections, then I suggest that we all go and retreat back to our respective sanctuaries and spend the rest of the evening in peace and tranquility, and indeed the rest of the week. So God willing, I'll see you next week. Yeah, probably next Tuesday. If you have any questions, for goodness sake, post them, email them, message them, because this is what we're up against. This is the level of questions we're up against. You want to get better answers, what do you do? Anyone? What do? You want better answers? Is that what you want? Yeah, that's right. You got to ask better questions, people. Yeah, I'm not saying these weren't good because I don't want to disrespect the people who ask these questions. Although a large majority of them were probably from my clinic. But yeah, if you have got a question, get it off your chest. Write it down. Send a stamped addressed envelope to us or message me on one of these myriad social media channels, of which I am a local celebrity, obviously. So, yeah, okay. Well, I'm going to go and go through there and walk around for a bit. So I'll see you next week. Have a nice week.